Well, this week it's Monday, Easter Monday, that we're having our tape session with David Ashford, Minister for Health and Social Care. This is the Q&A time, and I just think it's going to go down in numbers, and then we find we've got loads more questions. Although, and again, we say this every week, some will have been heard before, but we never know, things can move on, can't they? So we'll do that. The question one, Mr. Ashford, break down the numbers, please, of tests carried out every day into tests from suspected COVID and tests from other reasons, i.e. healthcare workers may get tested. So, they want to see what the breakdown, I suppose, between new cases and people just getting retested.
Yeah, we don't record in that way, Paul. While we can split off those that are tested going into hospital, we don't actually split that out. That information's not held in that way. It would be a manual process to do it. A test is basically taken and it's sent up to the lab, and it comes back negative or positive. We do not record. We split off those that are done in the hospital and those are done in the community, but we don't hold that drill down information in relation to community testing, whether it's someone who's volunteered for testing or someone who's been asked to undertake a test.
Therefore, I was going to say, you don't know even how many of that total percentage is taken up by retests at all then?
Well, in terms of retests,
health workers, whatever, do they get retested?
Well, sorry, the surveillance testing, no,
yes.
We don't hold that information because it's not continuous. People can opt in or opt out. There is no compulsion on people to be tested in any form. The numbers, I believe, are exceptionally low.
The original vaccine programme involved retaining sufficient vaccines for the second dose as to guarantee it at the time of the first dose. We now have a situation which appears that the second dose is not held in stock, and we hear supply issues could be a problem. Can the government absolutely guarantee each second dose within 12 weeks? And if so, on what basis can this guarantee be made? If it cannot be guaranteed, what is the backup plan?
Yes, at the moment, based on the delivery schedules, we can guarantee it. Again, it's one of those where things change. If there's any further disruption to the delivery schedules, we would have to look at it. But what we do is we hold what's termed a buffer stock. So we always hold enough stock for the vaccinations coming up. Now, at certain points, that buffer stock will run exceptionally low. It will run down to 3 days. So we'll only hold enough vaccination for the people being vaccinated in the following 3 days. But generally, the buffer stock is between 7 and 10 days. So that includes both first and second dose. Now that everyone has moved to the 12-week ratio, we should have finished the entire adult population first dose in May. And what that means is that at that point, everything that we receive would be second dose, basically.
And loads of people in different forms are just still coming up with the worry about the blood clots, but it's still incredibly low proportion.
Yeah, in fact, I know the Health Marketing Authorisation Committee in the UK has looked at this. Again, they stress that they haven't found an established link. There is no one that has, but they've said even in relation to these rare clots, you would expect there to be roughly around about 3 to 6 per million people in the normal population. There's been 18 million AstraZeneca doses delivered in the UK, and to date they've found 30 cases in a vaccinated population. So that is actually lower than what you would expect in an unvaccinated population.
I think Boris Johnson said you're more likely to be hit by a UFO or something. Well, not quite that level.
The Prime Minister has a lot more varied and colourful phrases than I ever go down the route of using. So we won't tempt fate with the UFO bit. But
probably more chance of winning the lottery. Maybe that's probably a better one.
But certainly in terms of the healthy population, you would expect per million people, I believe, with this particular type of blood clot, to see 3 to 6. In a million population a year. To date, there's been 18 million AstraZeneca doses. There's been 30 identified in the UK. So if you do the maths, that's actually lower than in an unvaccinated population.
Now, the next question, I've actually used it during our press conferences because this is where it first came to, and I don't think we had an answer. You said you might go away and have a look at it, and it says, as stated, all crew working on the steam packet have received their COVID-19 vaccinations. This is not entirely accurate and a bit misleading. No support worker who go on both vessels and do mix with crew have received vaccination. This seems to be an oversight, but a glaringly obvious flaw in the plan to keep the island safe.
Yeah, I will take that one. The Chief Minister didn't hand over to me for that question, so I didn't get a chance to have an input into it. In relation to that, or the crew that gets vaccinated with the steam packet are those that are travelling into the UK. because they're travelling into a different infected jurisdiction. Those that actually board the boat, say, to clean when the boat is in dock, they will not be eligible for the vaccination. And from the way the person's describing it, they shouldn't be mixing with crew in that way anyway. To be perfectly frank, I'm not sure what role they do because it's not described in the email, so it's impossible to give a standard definition. But the risk to those who are boarding in the island is actually exceptionally low, because they're not mixing with the passengers as well. They're not mixing with the boat in full operation. So as long as they have appropriate PPE and mitigation in place, which the company should have in place, then actually their risk, it's not zero, because nothing has zero risk, but it is exceptionally low.
You need a signal. You need to wave at the camera, because I know when you're on the Zoom it's harder, but we do this all the time. But you need to get hold of the chief to make sure you get your tuppence worth in. That would have brought that one to the fore straight away. A member of my family is admitted to Nobles with COVID. Unfortunately, the situation deteriorated and they went into ICU. The situation got even worse and they were transferred to an ICU in Liverpool. We've been keeping an eye on the daily numbers, and everyone does. We noticed today that the ICU numbers had gone to zero, despite our family member still being in a serious condition in the UK. And it goes on basically saying, should that not still be on the list? They've been moved to the UK.
Right, I need to be very careful. Obviously, I can't talk about the individual case, but I can talk around the statistics side of it. In relation to the statistics side, Paul, we've always made clear that we refer to people in the hospital. So, because that is the pressure, we report that so people can see what the pressure is on Nobles. If someone is transferred to a facility outside of Nobles, then they do not continue to feature in the statistics. That's always been the case, because the reason we report the ICU figure is to show the pressure that ICU in Nobles is under. If that person isn't in ICU in Nobles, then they are not adding to the COVID pressures onto the hospital. So the figure for ICU will be zero. That doesn't mean we haven't got a case in the UK where someone is receiving treatment.
Next one about travelling and how Coman Chief Minister, yourself, Dr. Hewitt, continue to enforce this policy of if one person goes across for essential, compassionate or medical reasons, they have to leave the family at home and then self-isolate for 3 weeks, or 2 weeks if you can afford £150 for the T3 test. This rule was created in January, and this person believes that after the New Year outbreak, it's not been addressed since then. When do you anticipate changing this rule?
Yeah, it's reviewed every couple of weeks, but at the moment, I would say what we've seen with this outbreak has shown that policy to be correct, because one of the things we are seeing is people testing positive later. So if the person is going into their household, we are seeing household spread. That's a lot of the cases from known source that are popping up, is still people within households where it's passing down the chain. So you're having people actually passing it on to people at different stages, and that is a serious risk, that if we do that, even with household testing, that someone can be released. So for the time being, with what we're seeing around the Kent variant, that is a policy I think that we do have to have in place. I know it's frustrating for people, and in many cases it's prevented travel, even in some cases where people really need to. But it is an important policy to protect our island at this current time. But hopefully, as the UK infection rate comes down and the outbreak on Ireland comes under control, that's one of the early things that we can reconsider about whether people can isolate at home.
This next question comes up all the time. Why are people still moving over here from the UK when the borders are closed? Have you any update on that? Or is it just
right, well, the first thing to say is the borders aren't closed. The borders were only, in terms of closed, very, very briefly last year after the first outbreak began, while we got to grips with COVID on Ireland and we learnt more about COVID. There is border controls in place, but people who wish to move to the island, who have a contractual obligation to do so that means they've either purchased a property, they have a long-term rent on a property, or they have an offer of employment, are still able to do so. It is not practical to shut the entire island completely down. We would grind our economy to a halt, and that's one of the big problems with COVID-19. We've not shied away from this, and I've spoken about it several times. It's a balancing act. It's a balancing act between health, preserving life, protecting the NHS, and also the economic and social impacts as well. And trying to get that balance right is sometimes nigh on impossible, but it's something we've got to look at, and it just would not be practical from an economic point of view to shut the island completely and totally.
This one's quite medical, but I'm sure you'll be up to it. What is our current maximum cycle threshold, the CT, to be considered for positive for COVID-19 in the Isle of Man? It's in 4 parts. This has the threshold changed in the entirety of the pandemic? If so, what was the reasoning for this? 2. Of positive cases, what percentage are above CT 30? Oh, it's actually only 3 parts. And the last bit, can the public get a full breakdown from historic test ranges as to where each positive threshold was made?
Last point first is no. I don't believe we hold that. The same with those that were over 30. I don't believe we hold that. In terms of the cycle threshold generally is 45. Now, I know where the person's coming from because they're going into this whole thing of the higher the cycle threshold, the more likely you are to get false positives. If we have something that is actually run as a positive at a high threshold, we actually test it on a different platform. So we do have multiple platforms in the lab, so we're not relying on that one result. If it tests positive at a high cycle threshold, we actually will rerun the sample on a different platform. But the general thing is 45. You can't vary from the manufacturer's instructions, is my understanding with the machine. You're going to have to bear with me with this one, Paul, because I'm not a scientist. But the cycle threshold is 45. But my understanding from certainly when I've spoken about this area is most of them are testing at a much positive at a much lower threshold than that, and particularly with the Kent variant. But if there's any doubt because of the high cycle threshold, the test is rerun on a separate platform to verify. And the fact is that, of course, what you're looking for is the RNA of the virus, and if it is present, then it will return a positive.
Okay. One more for this section. Can you ask, will the island require vaccine passports to travel in and out? UK thinking about it. Surely the island must have it in place if they're to get back, I suppose, into business again with the UK.
At the moment, we're not looking at that. I know the UK's been talking about vaccine passports for various things, as of other countries. But to be honest, as with a lot of the European countries, it depends which politician you're listening to on any given day, really. As to whether you're going to have them or not. The issue with vaccine passports at the moment is we know that the existing vaccines that are in play don't actually prevent someone catching COVID-19. And although the most recent studies are exceptionally encouraging in the amount of transmission they reduce, they still don't stop someone contracting it and passing it on. So a vaccine passport wouldn't necessarily be a benefit in that way to the island, because you could say to someone, yes, come on in. They might be harbouring COVID-19 and they can still pass it on to unvaccinated people in the community. So it's not like a yellow fever jab that once you've had it, you can't contract and communicate it. So it's very different. So at the moment, we're not looking at that. But from an external point of view, if other countries start going down that route and we need to be able to provide evidence, people need to provide evidence of people being vaccinated, then we will look to be able to provide that for people so they can continue to travel in the same way as we offer the private testing for travel.